And Columbia Public Schools just finished its first full week of district-wide hybrid learning. Right now, Superintendent Dr. Peter Stiepelman joins us live to talk about how the return is going. Thank you so much for being on with us this morning, Dr. Stiepelman.
Good morning, Molly.
And so you now have a full week of that hybrid learning under your belt. How has it been going for you guys?
Yeah, so yesterday I was in buildings. I was in an elementary school. I was in a high school. I saw great examples of instruction. I saw teachers who were instructing students who were in front of them, as well as students who were zooming in, particularly at the high schools. I saw great use of masks, and when a student wasn't wearing it totally appropriately, where it would be below the nose, it didn't take but a second for someone, either a student or an adult, to say, hey, don't forget. So really great compliance there. I saw really good social distancing to the greatest extent possible. And I just really want to compliment our principals who really, since June, when we wrote our plans all together, are having the opportunity to implement, because I saw really good examples of them trying to find different ways to space students, whether it be in the classroom or throughout the building.
That's great to hear. And now, almost 2 weeks ago, 70 staff members were on leave for COVID-19 reasons. Now, that number was at 48 as of last night. Is the district in a good situation with staffing right now?
Well, I can tell you that 9 out of the 21 elementary schools have been impacted by isolation or quarantine, 4 out of the 7 middle schools, 1 out of our 4 high schools. So we do know it's a real thing. But yeah, I do agree that, we've been really careful about reminding and just reminding ourselves about the best practices involved with being back in person. And that involves staff not congregating together. And so they've been really cautious about doing that. So right now, 48 is a lot better than what it was when we came back in October. But we're going to have to be vigilant. This week in particular, is an important week for us.
Have any more staff members been able to receive the coronavirus vaccine? And if so, how many?
Yeah, so almost about another 50 over the last week have been able to access the vaccine through our amazing partners over at Boone Hospital. And so we're really pleased about that. As you know, we're in right now phase 2, right? Phase 1B, and then we're in tier 2 of that. And so individuals who are over 65 or our employees who have underlying health conditions as identified by the state are able to access the vaccine earlier than the rest of the school employees. So, but we're really pleased with our partnership. Boone Hospital has just been tremendous.
Now, we've actually reported on some issues with state rollout of the vaccine. Now, actually, when the next phase is activated, do you anticipate Boone Hospital having the stock in order to vaccinate your educators?
Yeah, so, that's really a question for Boone Hospital. What they've done for us is help us write our plan. And as vaccine becomes available, their leadership there has been phenomenal about reaching out to us and then just going down our list and making sure. So I know that both Boone Hospital, I know that MU Health, and I know that D&H and others here in town are eligible to receive the vaccine. And when they have it, they're making it available. So yeah.
And how does waiting for vaccines impact the district's modes of learning for you?
Yeah, and so as you might expect, as the Board of Education watches closely, they're watching the case rate, as you identified earlier, for staff has gone down. And so, we really are a mirror of what's happening in our community, as the American Academy of Pediatrics identified. And so they're watching case rates, they're watching isolations and quarantines, they're looking at the number of vaccines that might be available. And so that all plays a role in what comes next in terms of our continued phase in. As you know, elementary is 4 days in right now as part of their hybrid, and then high school and middle school are in the 2-day hybrid with students zooming in on the days that they're not in. So, this vaccine is a major part of our phase-in plan, and we just are so encouraged by the fact that it's starting to roll out, but we'd really like it to roll out even faster. I know everyone around the state is.
More students are out for COVID-19 reasons than 2 weeks ago. Are a majority of these quarantines or close contacts due to exposures within schools?
Yeah, it's actually, we've had some examples of both. So we've had some examples where students have tested positive at school. The school district has the ability to do some antigen testing. And so when a child is tested and tests positive, then we're required to do quarantines. And so that is resulting at school. And we also know that, again, the community and the school district are not, they're not separate. They're completely inextricably linked. And so what's happening in the community happens in the schools. And so as community rates rise, so will the schools. And as the community rates drop, as we've been seeing, so will the schools as well. So, but they are quarantining based on the fact that if we do have a positive at school, we're looking at who is around 6 feet from that student, who's been in contact for 15 minutes at a time, and then quarantines are being done.
And now, what does the pool of substitute teachers look like right now? I know we've talked a lot about staffing shortage issues.
Yeah, so last week on Thursday, EduStaff, which is our contracted service for substitutes, they came to our board meeting and gave a presentation and answered questions. So we've actually added about 50 subs from when I've been on your program earlier in the semester, and so that's good news. And then there are 189 additional subs that have just not completed all their paperwork, and of that 189, 111 of them simply have to do a 7-minute COVID training module. So what that tells me is that there are a number of individuals who are interested in subbing, but they would like to see the vaccine first. And so it's just another emphasis for all of us of why we're encouraged about what a vaccine will mean for our ability to carry out school.
And then one last question we have this morning is, we heard that there was a donation of about 2,000 masks coming to CPS today. What other kind of community efforts have come to help the district at this time?
Yeah, our community has been incredible in terms of its support for our schools. In particular, when you mentioned the masks, that was a donation that we learned about late yesterday afternoon. And so it appears to be N95 masks. So we're encouraged by the donation. We're expecting to receive those today. And then what we'll do is we'll receive that centrally and then review and then kind of decide what our next steps are. One of the things that we're really encouraged by is that group that has made that donation has also indicated a willingness to really work on helping us get child-sized masks, because that's really where our need is. And so we look forward to continuing to partner with our community who continues to reach out to support its schools. So we're grateful. Thanks for asking.
Yeah, that's awesome to hear. Thank you so much, Dr. Stiepelman. That's all the time we have right now, unfortunately, but we appreciate you being on with us as always.
Always appreciate it. Thanks so much.